What are the limits of the BCG vaccine for active TB? The BCG vaccine, or Bacillus calmette-guerin vaccine, plays a crucial role in the fight against tuberculosis, but it has its limits, especially when it comes to preventing active tuberculosis disease. Understanding these limitations is essential for anyone interested in tuberculosis prevention and control. First, the BCG vaccine is highly effective in preventing severe forms of tuberculosis in young children. It can provide over 80% protection against serious conditions like TB meningitis and disseminated TB. However, its effectiveness drops significantly in adolescents and adults, particularly against pulmonary tuberculosis, which is the most common and contagious form of the disease. Another important point is the duration of protection. The immunity gained from the BCG vaccine tends to decrease over time. This means that while children may be well protected shortly after vaccination, that protection may not last into adulthood, leaving older individuals more susceptible to active TB. Environmental factors also play a role. Exposure to other types of mycobacteria in the environment can interfere with how well the BCG vaccine works. There are two main theories about this. The masking hypothesis suggests that prior exposure to environmental mycobacteria can reduce the effectiveness of the BCG vaccine. The blocking hypothesis proposes that these environmental mycobacteria might prevent the BCG vaccine from stimulating the immune system effectively. Additionally, receiving multiple doses of the BCG vaccine has not been shown to provide extra protection against pulmonary tuberculosis. This lack of a boosting effect limits options for extending immunity beyond the initial vaccination. Geographically, the vaccine's effectiveness varies. In tropical regions, where tuberculosis is often more prevalent, the BCG vaccine tends to be less effective. This variation may be due to differences in exposure to environmental mycobacteria and genetic factors among populations. Lastly, it is crucial to note that the BCG vaccine does not reliably protect against the reactivation of latent tuberculosis infection into active disease in adults. While it helps prevent initial infections and severe forms of TB in children, it does not stop latent infections from becoming active later in life. In summary, while the BCG vaccine is a valuable tool for preventing severe tuberculosis in children, it is not sufficient alone to control active tuberculosis disease in adults. This highlights the need for new, more effective vaccines and additional strategies to enhance immunity in older populations. To effectively reduce the burden of tuberculosis, vaccination should be combined with early diagnosis, treatment of active cases, and preventive therapy for latent infections. Always consult healthcare professionals for personalized advice regarding tuberculosis prevention and treatment.